Hello everyone, my name is Herbert and I'd like to tell you something about kidney cancer and surgery that goes with it by removing a kidney, talking about my left kidney and how it all came about. I'm a normal person and I always felt quite healthy, but last year I didn't feel so healthy. I wasn't fit, I didn't have much energy. I lost some weight, I lost some muscle, so I went to my doctor and he ran me through. He did blood work, which didn't deliver anything. And I said, look, I'm not feeling great. I think I might have like some Parkinson's or something like that. And he gave me a letter to go to the neurologist, which I did. And after a year of investigations, going to other university hospitals, it came out that I had a muscle disease called myasthenia gravis, which can be a heavy disease, but in my case it was quite good managed with medication. I won't say that I don't have symptoms, but there it is. I'm doing okay. I still didn't feel that great physically, so I didn't have a lot of energy, a lot of muscle. I didn't have a lot of muscle. It was hard to gain muscle, even though I had a good healthy lifestyle, good sleeping, good eating, low stress. So I still did think, yeah, okay, what's wrong with me? So that's a little bit of prelude to what's coming about kidney cancer and kidney surgery, which is also called radical nephrectomy. Look, in November, my neurologist said, we're gonna have to make a CT scan of your chest, because it might be that the thymus, which is a small organ between your lungs and your heart, it might be enlarged, and that would have to mean it would have to be removed, and it goes with the disease of myasthenia gravis. In those cases, your thymus could be enlarged, and if they remove the thymus, in that case, it could help your disease. Actually, this my cat Pumpkin is looking also. So I did that. I had a CT scan of my chest, and I came back in December, the day after Christmas, and my neurologist said, I have good news for you and bad news. Okay, I was nosy what that was, so I said, okay, give me the good news. She said, your thymus isn't enlarged, so you won't be needing an operation. You're going to be okay with the thymus, and it doesn't have an effect on your myasthenia gravis, although we did tweak the medication a bit. I took a bit more to feel a bit better, and it helped some. And I said, so what is the bad news? She said, on the CT scan we did see something on your left kidney, which looks like a very, very big tumor. So that totally blew me away. I was shaken, and she said to me, it looks like a very big tumor, but your kidney isn't on full, because the kidneys are a bit lower than the chest. So it was a catch we didn't expect, so we need to do a second CT scan of your entire upper body. I said, I'm okay with that, and of course I was anxious and felt scared. But I had a scan quite quickly, in a couple of weeks, in 2 weeks or something. I had the next scan, and it showed the same result, and it wasn't with a neurologist this time, it was with a urologist, which handles the kidney part of your body. And she said, look, you have a huge tumor on your left kidney, it's over 11 centimeters. The kidney will have to be removed because it's so big. We can't do a partial nephrectomy, which would mean removing part of your kidney. It can't be done. The kidney has to be removed in full. So that shook me, but I thought, okay, I'm okay with that. Alone there was a concern about, do I have metastasis? Is the cancer spreading throughout my body? She said, look, we don't think you have metastasis, but we're not sure. We've seen some things on your liver, some spots. There could be good lesions, they're called angiomas, but they also could be metastasis. And so that made me really afraid, because having metastasis means your life expectancy goes from like 60, 70, 80% in 5 years to 10% in 5 years. And essentially it means for most it's a death sentence. So I was really anxious to know if there are metastases. And I said, how are we going to find it out? She said, look, we're going to do another scan in another hospital. It's called a PET FDG scan. It's use of radioactive glucose, which will be intravenously bring into you. And that will light up when there's cancer. So if you have huge cancer, like on your kidney, it will light up on the scan. And if there's a cancer in other places, like on your liver, which could be, that will light up as well. And of course, it's also useful to see if there's cancer in other parts of the body of this kidney cancer, metastasis, or other cancers which she didn't expect, but still good to make sure. So I had the FDG PET scan. It was a wacky experience. It involves drinking a lot of water, peeing a lot, having radioactive glucose in you. And they made a second PET scan on the spot, which they didn't say in front. But the doctor there decided, the radiologist, and I thought, okay, that's funny. One PET scan is quite expensive, and they made another, it's also expensive, of my kidneys especially. So I was a bit anxious of the result, which came back from the urologist, and she said, it looks like your huge kidney tumor on the left kidney is quite active. It light up a lot, like a Christmas tree. But we still didn't see something else light up. So it looks like there are no metastases on your liver. There could be an angioma, which are good, not malignant. So there was a relief. But she said, like, look, the radiologist still doesn't know for sure if it's malignant or benign on your liver. You have to make another scan yet. So there's going to be a four scans within like 6 weeks. And it's going to be an MRI scan, which I had this week. I had to wait a couple of weeks. Look, I don't know if you had an MRI scan before, but it's quite noisy. It's quite claustrophobic. And I don't mind, but it's not a pleasant experience. Okay, I did it. Always get a bit anxious, but I did it. It went okay. It always gives me a bad feeling when in the waiting room of radiology, and like I'm 54, but there's like a load of very old people sitting there, and obviously I don't want anybody to be sick, but I can understand you're being old, your risk of being sick is bigger. But I'm always sitting in those waiting rooms lately, last couple of months, and thinking, man, I'm the youngest one. What has happened to me? So it's not good for your mood. Okay, although I do try to get through it with the help of family and friends. So I did an MRI scan. It came back. The MRI scan was Thursday. It's now Saturday. My urologist called me Friday, and she said, okay, this is good news. The MRI scan, which is a really good scan to see everything from the inside and the outside, looks like you have no metastasis, no cancer in the rest of your liver or on the body. It's benign. It's not dangerous. So that's a relief. And now onward. Look, I told you I have a kidney cancer. I have a huge tumor on my left kidney. It will have to be removed. And that's going to happen. It's going to happen February 24th, in like 9 days from now, in a hospital 30 kilometers from my hometown. I live in a normal town, but that's in what somehow a bigger town, where a very good surgeon with a huge experience will operate me with a Da Vinci surgery robot, which is quite spooky, but they say that is better for wound healing. It's a less dramatic surgery than an open radical nephrectomy, which means cutting open the belly, which leaves huge wounds and will cut through a lot of muscle. Of course, this will leave wounds too, this robot surgery, and this will cut probably through some muscle too. But it's said that it will take shorter time to recover, and that's less heavy on the body. I will probably stay a couple of days in the hospital, and yeah, I think like, let's do this. Let's get this cancer in this kidney out and try and heal after that, and I hope that it doesn't come back. Of course, I will have to go to another scan in some time, 3 to 6 months later. And I'm a bit anxious because, like, having such a huge tumor, how fast did it grow? What type is it? I think I heard about 5, 6, 7 types. Some are quite slow growing, which could mean it would have been in my body already for like 5 to 10 years, and some are really fast growing, which could mean it will be in my body for like 6 months to a year, which could be not so good because those are usually aggressive and often come back. So when it's been taken out, the left kidney, and the tissue has been sent to the pathologist to investigate, it's nerve-wracking because the type of tumor will determine if I need just a CT scan in a couple of months, of if I will need when in the other case, if it's not kind of a good cancer but a bad cancer which is fast growing, aggressive, it could mean I would have to have immunotherapy or tyrosine kinase inhibitors or some type of other medical treatment, which is kind of heavy, can have a lot of side effects, and I would not enjoy it, but I would have to do, of course, because I want to live, but it's not something I was look forward to. So there's a lot of tension in that, and of course there's the tension of the operation. Look, I had surgery before. 5 years ago my appendix was removed. It was infected, it ruptured. So I had a lot of pain. It was removed. It was surgery also through keyhole surgery, laparoscopic surgery, kind of like, not with a robot, but kind of the same way. A few small cuts in the belly and one larger to get the organ out. But that was quite painful, and it took me a couple of months to recover, so I didn't enjoy that. And I heard that kidney surgery is even heavier, more painful, so I'm not looking forward to that. No, I'm a big adult person, but I don't like pain. But of course I will have to undergo it, and I will take painkillers and look after my body and have a lot of support, but still, man, that's a lot to incorporate. So that's the plan for now. In 9 days there's going to be surgery. It looks like I'm cancer free for the rest, but there's no guarantees for that. So we're going to have to see. Of course I will do a lot of more videos. They could be short, they could be long. I don't know how I'm feeling. But I noticed on the internet there's not a lot of videos of people talking about their kidney cancer and preparing for surgery and telling the whole story. So I thought I would record one for myself. Look, like you heard, I'm not an English speaker. I'm Dutch, I'm from Holland. I think I speak English reasonably well, but sure I've got to have an accent, and sure there's going to be some wonky, cronky speaking from me. So just have to forgive me for that, because I love to tell my story to you guys. I'm going to make a video in Dutch as well, so my Dutch people can understand as well. It's going to be a lot less wonky and clunky, but I hope you can deal with it, because I would like to share with people. I saw some good videos on there, especially from a guy called Declan Gregnam Smith. He had a great video, and which was informative but also emotional, and kudos to him. And I like to make a contribution as well. It's not about being known or something, but you know, you've got resources out there and you're anxious and you can learn and you can see how it goes with other people, I think that can help. Okay, thank you guys for watching this video, and I'll be back. I'll be posting and telling you guys how it went. Okay, bye for now. See ya.